Imagine you wake up one morning in your mid 40s or 50s and suddenly the rules of your body starts to change. Sleep feels lighter, mood shifts happen without warning, intimacy doesn't feel the same, and your energy seems to vanish without explanation. For many women, this stage of life is called menopause. But what often gets overlooked is how deeply it affects not only physical health but also sexual health, relationships, and overall well being. I am Dr. Ahmed Arslan. I am a certified urologist, and today I will walk you through the hidden truths of menopause and sexual health that every woman over 40 must know. We will explore the risks if you ignore these changes, the science behind what's happening inside your body, and most importantly, the practical solutions that work. Stay with me till the end because you will discover how small daily habits can restore confidence, intimacy, and balance during this new chapter of life. Most women think menopause is simply the end of periods, but it's far more complex. Menopause is defined as 12 months without a menstrual period, usually around age 45 to 55, but symptoms often begin earlier in a stage called premenopause. Here is the hidden part: menopause isn't just about reproductive health, it's a whole body transition. Common symptoms like hot flashes, night sweats, and vaginal dryness are only the surface. What women often don't realize is that menopause also affects the bladder, heart, bones, mood, and sexual health. A major myth is that sexual health problems during menopause mean a woman has lost her femininity. That is completely false. In reality, changes in sexual health are biological responses to hormone shifts, not personal weakness. So, here is a question for you. If these changes are natural, why do so many women feel ashamed to talk about them, even with their doctors? Ignoring menopause symptoms can silently affect long term health. Let's break it down. Vaginal and urinary changes. Lower estrogen levels cause thinning of vaginal tissue, dryness, and sometimes painful intimacy. This also increases the risk of urinary infections. Bone health. Postmenopausal women are at much higher risk of osteoporosis and fractures. Heart health. After menopause, the protective effect of estrogen on blood vessels declines, raising the risk of heart disease. Mental health. Sleep disturbances, mood swings, and even depression becomes more common. Sexual intimacy. Discomfort, low desire, or fear of pain can strain relationships, leading to frustration on both sides. And here is the cliffhanger. Studies show that sexual health after menopause is not just possible but highly fulfilling if the right steps are taken. So, the real question is what's happening inside your body and what can you do about it? Think of estrogen as a protective blanket. For decades, it covers your bones, your heart, your brain, and your sexual organs. When menopause arrives, that blanket thins out, leaving those symptoms more exposed. Here is what happens: estrogen drop. This reduces natural lubrication and elasticity in vaginal tissue, causing dryness or discomfort. Progesterone and testosterone shifts. These influence libido, mood, and sleep. Yes, women produce testosterone too, and it plays a role in sexual desire. Brain chemistry. Hormonal changes affect serotonin and dopamine, the chemicals linked to mood, focus, and satisfaction. Think of your body like a car that has run smoothly for years. Suddenly, the engine oil runs low. If you keep driving without maintenance, the engine wears out faster. But if you understand what's happening and refuel properly, the car can still run powerfully for years. So, what's the fuel for women after 40? Let's talk about solutions. First, the medical solutions: vaginal moisturizers and lubricants. Safe over the counter options that reduce dryness and make intimacy comfortable. Hormone therapy. For some women, low dose estrogen as cream patch can relieve hot flashes, dryness, and protect bone health. But it must be discussed with your doctor, weighing benefits and risks, especially in women with heart disease or breast cancer history. Non hormonal medications. For hot flashes and mood, certain antidepressants or other drugs may be prescribed. Now, the natural solutions and daily actions. Regular exercise. Weight bearing exercises like walking, dancing, or light weights strengthen bones and boost mood. Diet rich in calcium and vitamin D. Milk, yogurt, leafy greens, and safe sun exposure protect bones. Omega-3 fatty acids. These are found in fish or flaxseed. They improve heart health and may support mood. Pelvic floor exercises. These exercises strengthen bladder control and sexual satisfaction. Open communication. Talk with your partner about changes, fears, and needs. Intimacy is emotional as much as physical. Remember, solutions are not one size fits all. A tailored plan with your healthcare provider is the key. Here is the empowering truth. Menopause is not the end of sexual health. It's the beginning of a new chapter of self-care. Think of lifestyle as your daily prescription. Movement is medicine for your bones. Nutrition is medicine for your heart. Rest and stress management are medicine for your mind. And open conversation is medicine for your relationships. Looping back to where we started, menopause is not just about endings, it's about transformation. The same body that feels unfamiliar today can, with the right support, become stronger, more balanced, and more connected than ever before. So, my final message is this: don't ignore the signs, don't accept myths, and don't be afraid to seek help. You deserve to thrive in this stage of life, not just survive it. I am Dr. Ahmed Arslan. If you found this helpful, subscribe for more evidence based health guidance because your health after 40 is not just about years in your life, but life in your years.